I really enjoyed watching the video about Elyn Saks. The question I want to answer is, when providing discharge education, what is pertinent to include to improve patient outcomes when managing their mental illnesses? So one thing I think is really important, and she mentioned in the video that has been really successful for her, is that she goes 4 to 5 days per week to psychoanalyst psychotherapy appointments for the past several decades. So I think it's important to have patients set up with resources and a support system. And she also mentioned her close relationships as far as her friends and family, but also at work. So to be successful, I think that not only their appointments with their therapist, but also their support system with friends, family, coworkers, which I know is hard to find in her situation. She had a good work support system. Unfortunately, a lot of people won't have that support system, so those appointments that they can go to with a therapist or psychotherapist would be really important. She also mentioned that she had excellent psychopharmacology, so in the discharge education, I think it would be important to include medication adherence. So talking to them about taking the medications, what to expect as far as side effects, and the wanted side effects of those medications, and letting them know that sometimes it could get worse before it gets better, and that it is expected to have side effects, but to keep taking their medications, not stop them abruptly, that type of thing. And of course, avoid restraints if at all possible. It was sad that she mentioned she spent up to 20 hours a day in mechanical restraints, and that 1 to 3 people die every week in restraints in the United States. So basically, to summarize, just really important to educate them on, and their family, on therapy, support groups, community resources, and medication adherence.